All right. Let's move on to health care. Congresswoman McSally, how much should government be involved in health care, especially when it concerns folks that find it difficult to get health care, specifically those with pre-existing conditions? What is the government's role?
Well, thanks, Ted, for the opportunity again to debunk another attack from my opponent. I voted to protect people with pre-existing conditions, to make sure insurance companies were forced to give them health care, had no caps on insurance, and could not cancel it. That is just a flat-out lie. We cannot go back to where we were before Obamacare, where people were one diagnosis away from going bankrupt because they could not get access to health care. And so although it was trying to fix it, Obamacare was the wrong approach. It's $1 trillion in taxes. It's robbing Medicare by $716 billion. It's mandates and penalties that were really intended to go after those who were falling through the cracks, who didn't get health care from their employer or Medicare or Medicaid. It ends up it's about 7% of people, and they're falling through the cracks. They're still falling through the cracks, Ted, because I met an entrepreneur this last week who decided to start her own business, who has pre-existing conditions, but because of Obamacare and because of skyrocketing costs, she has no coverage right now. More people paid a penalty last year than actually bought insurance on the Obamacare exchanges. So we have to address the issue, and we've got to make sure we protect people with pre-existing conditions, but the Obamacare model has failed. We moved forward with an approach that gives people tax credits and gives them options to shop around, more small business support, to have association health plans, more opportunity for people to give to health savings accounts that still can provide affordable, available health insurance for them, which isn't working right now under Obamacare. So we've got to protect it. At the federal level, there should be a part, but it's best managed at the state as well, where there's more options for them to be innovative, because what works in California is not what works in Arizona.
Rebuttal, please.
Well, I'm so glad we're talking about healthcare, because it is the #1 issue that I hear from folks, both on the campaign trail as I travel the state and in my office in the United States Congress. Arizonans are very worried that they will lose coverage for those with pre-existing health conditions. Nearly 3 million Arizonans live with pre-existing health conditions. One example is a woman named Leslie. She lives in Scottsdale. She was diagnosed with diabetes when she was in high school, and she's been taking 5 insulin shots a day for 47 years. But when Martha voted last year to repeal existing law, it would have eliminated the protections for people who live with pre-existing conditions in our country today. She also voted to repeal that same protection in 2015. So the reality is that Arizonans are worried about losing access to this critical coverage, and Martha voted to take that protection away.
That is just a flat-out lie. Again, these are just classic fear tactics. If you turn on a TV all over the country right now, the Democrats have nothing to run on, and so they're choosing to play with fear. I voted to protect people with pre-existing conditions. And as we were moving forward and nothing was moving through the Senate related to this issue, 14 of 15 counties in Arizona, there was only one choice last year. That is not a choice. And the premiums have gone up over 100% year to year. There's so many people right now with pre-existing conditions that can't get access to health care because the Obamacare model doesn't work. But when things came to a standstill and we were watching these individuals still not able to get access to health insurance, I sat down with my Democrat colleagues in the Problem Solvers Caucus, and we sat down to see if there's any way we can find some common ground to help these people get access to health insurance, and we came up with a plan. There was me and a couple of our Democrat colleagues out there with a whiteboard in my office. We know what we can disagree on, but is there something we can find to help stabilize this market as it was collapsing? And we came up with a plan that 23 Democrats and Republicans, or at least the majority of the group, agreed to. So we showed that we could break through the gridlock, solve the problem, and actually help people get the insurance that they deserve and get the care that they deserve with the conditions that they have in their family.
Again, government's place in health care.
Well, one thing I think all Americans can agree on is we cannot go back to a time when people couldn't get coverage when they had pre-existing health conditions. So while Martha talks about a working group and part of the Problem Solvers Caucus, which I am a proud member of, the reality is that we took the vote. And during the vote, Martha voted to repeal these protections. And they are the protections that Arizonans count on every day. That same vote also took away protections for people ages 50 to 64 and would have allowed states to begin charging them as much as 5 times more for their coverage. That's just not fair. And finally, that piece of legislation that she voted for would have increased premiums by as much as $1,500 per year per family. So while we all can agree that our healthcare system is broken and needs to be fixed, the solutions that Martha has voted for actually make the system worse and hurt Arizonans. But she's avoided talking about this issue during the campaign because she knows that her vote hurts Arizonans and has instead chosen to just lob attacks against me on other issues.
Your response? That is just an outright lie. Again, I voted to protect people with pre-existing conditions, to ensure that insurance companies cannot deny someone coverage if they have a pre-existing condition. And when it comes to this age tax they've made up, the only person in this Senate campaign who's voted to cut your taxes is me. And so, you know, age 50 to 64, calling them older Americans, by the way, I am in that age group, so I take offense to that. What we were trying to do is make sure that premiums come down for everybody, that there's options for everyone to be able to get access to affordable, available care. And that's not what Obamacare has done. As we were working on our bill, and I was concerned about the tax credit, specifically for age 50 to 64, I personally lobbied to make sure an additional $90 billion was added to the bill for an additional $2,000 of tax credits for everybody aged 50 to 64. That was included in the bill because as we move away from the failures of Obamacare towards something that's more options for people to get access to insurance that's more affordable, it's gone up over 300% in Arizona since Obamacare. Then these options are a better path. Give people choice. Let them make decisions between them and their families and buy the insurance that fits their needs.